Hey, what's going on, guys? Today's video is going to just entirely entail of me trying to explain what physical therapy is and what we do as physical therapists. Because as of recently, I just graduated and I've been getting a lot of questions about what physical therapy is and what we do. Oftentimes, people assume that we're glorified personal trainers or that we are massage therapists, which there is some truth to it, but it's not entirely true because I feel that kind of really undermines what we do as physical therapists. Best way I can describe it is physical therapists are at the forefront of promoting movement, maximizing healthcare, and minimizing the medical burden that's placed on society. So it's also been proven to be cost effective at reducing medical burden placed on society. So that's what physical therapy is. Now, what we do, simply put, think of someone having the inability to do something and they want to go back to doing something that they want to do. If they want to do something, that is called a participation restriction, or they must do something, that is called an activity limitation due to the pain that they are experiencing or whatever dysfunction that they have or whatever impairment that they have. Let's say, for instance, a patient has knee pain that is preventing them from running. As a physical therapist, see why they have that knee pain. I'll treat that patient from knee pain to hopefully no knee pain to be able to run again. So that's participation. Now, it's different for every patient. Now, if it's a patient that's in their 5th, 6th, 7th, or 8th decade of their life and they have back pain, that back pain is preventing them from being able to do activities of daily living, such as grocery shopping, as going to the bathroom independently, cooking, cleaning, doing household chores, driving. They have this activity limitation due to the pain that they're experiencing. As a physical therapist, it's your job to educate and promote movement, to give the most evidence-based practice, such as manual therapy, dry needling, if appropriate, and anything that you're able to do to help heal that person as much as you possibly can to go to that prior level of function to do what they need to do. That's the best way I can put it. That's different from every single person. And what makes a great PT is their level of efficiency in being able to help heal that process and their ability to problem solve, to streamline therapy, to get back to what they want to do as fast and as quickly and as safely as possible. It's now one thing I want to kind of really emphasize. The body has this amazing ability to heal itself from a painful experience to a non-painful experience. That's if they stop painful range of motion, maladaptive movements, stop doing things that keep hurting them. They will eventually start slowly going back to their prior level function and be healed as much as they possibly can. Now, physical therapists help kind of take that ability and accelerate that process faster. The body's going to heal itself, but that may take 6 months, that may take 8 months, it may take however long it takes. Physical therapists may be able to accelerate and catalyze that process into maybe a couple weeks via education, evidence-based practice, looking at the biopsychosocial model, by looking at every single possible thing that's able to treat that patient, go back to what they want to do faster, safer, and more efficiently. And that's our job. That's basically my job, is just to problem solve. I'm trying to collect as much data as I possibly can. Look at their history, I look at their past medical history, I look at their comorbidities, I look at their ability to do certain movements, I look at their movement patterns, I see what kind of medication they're taking, if they're taking any medication. I look at their diagnostic imaging, such as X-ray, MRI, CT scans, anything that I possibly can gather from that person, any kind of past injuries, any neurological deficits, anything that I possibly can take from that patient. I'll go ahead and collect that information and I'll synthesize that into like a Rubik's Cube. I'll try to basically solve this Rubik's Cube, right? Which is, I'm formulating this hypothesis into why they're experiencing this kind of pain, and I'll try to solve it into hopefully finding the desired outcome that I want. So I'm taking a hypothesis, I'm testing, I'm measuring, and I'm experimenting to hopefully get the outcome that I want. If I don't get the outcome that I want or that the patient we always look at patient's goals. If I don't get that, right, I have to reconsider the hypothesis. That's why it's important to formulate primary, secondary, and tertiary hypothesis in order to be able to test and measure and be able to tell what is happening. That's basically it. Like, that's what I do for a living. And I hate is a strong word, dislike when people undermine what I do. And I don't think the philosophy of PT is that complicated. And so that was my attempt to really just explain in simple terms what physical therapists do. I really hope that makes sense. If it doesn't, sucks to suck. Just comment down below, let me know what doesn't make sense, and I'll try to clarify further. But yeah, that's pretty much all I have for today. Cheers. See you guys later.